and we have so many people in the hallways that are all COVID positive.
Essential workers, medical staff, cleaning crews, and first responders. They work every day to meet a substantial demand, saving lives in a now historic pandemic. But there's another group of workers the federal government deems as essential: farm workers. They help sustain our nation's food supply, and they're on the move to farms across the country for the largest growing and harvest season of the year. The problem is,
at some of the clinic sites, the migrant farm worker clinic sites have actually closed in the last few weeks because of the lack of funding.
the clinic sites serve as a health safety net for underserved and vulnerable populations. They typically see more than 28 million patients across the country, including farm workers. The U.S. Health Resources and Services Administration's Health Center program funds the clinics, but state restrictions aimed at slowing the spread of the coronavirus have either cut money-making services like non-essential surgeries or shuttered clinics altogether.
They're furloughing people, and so there's a real lack of access for farm workers to be able to go to clinics to be seen, to see whether or not what they have and whether or not they have COVID.
HRSA keeps track of how its health centers are affected by the COVID-19 pandemic. At the time of this reporting, HRSA reported just over 1,900 temporary site closures. The majority are in California, the top agricultural producer in the U.S. The closures exacerbate issues that existed before the pandemic.
In rural America, we don't have access to the tests in the same way that other people do. Some places in rural America, there are no hospitals nearby, so people are having to drive an hour or an hour and a half away to get medical care.
But some health centers are making sure that isn't the experience for patients in the communities they serve.
Our message to our communities has been, we are open for business.
Mary Zelazny runs 8 health center sites in rural or agricultural counties across New York State, a coronavirus hotspot.
Like in my communities, people aren't testing. There's not a lot of testing going on. We're it.
Since closing isn't an option, Zelazny said she had to make operational changes.
So we did furlough some of our dental team, for instance, our dental hygienists, a couple of billing people, because we just didn't have the number of visits, right? The model we have built is that in every one of our health centers, we have a full-time RN there at that site at all times.
Her sites also offer drive-through testing, which is in part supported by federal aid funding.
We did get a PPP loan, and we've already got the money. We did it the day it came out. We applied that we could. And then we've gotten some assistance from HRSA through the CARES Act. One
change she didn't have to deal with: adjusting to telehealth.
We have been using telehealth technology since 2008. That was not a new thing for my team.
Zelazny is a strong advocate for telehealth and a leader in its implementation. With that said, she's aware of its challenges.
It has been new for some of our patients. That's been a change. And in rural communities, you have a lot of other barriers, and the big one being broadband access, of course.
It's a challenge Velma Hendershot knows well.
The team had within a matter of about 24 to 48 hours, get up and running, and they did a spectacular job of getting the organization up and ready to provide that service.
She's the CEO of Intercare Community Health Network.
We unfortunately had to furlough and put some people on leave, probably about 25% of our staff. We've had to transition to doing a lot of our work through telehealth, through whether it's through televideo or through telephonic services.
Based in Michigan, it serves the largest number of farm workers in the Midwest.
We are starting to see some of our farm workers arrive in the area, and so we're starting to get ready for our outreach activities and providing healthcare to our migrant and seasonal farm workers in our community.
While telehealth was new for Intercare, its outreach efforts were not. It was one of the first health centers to bring health aids to farm workers, whether it was by boots on the ground or mobile medical units.
This year, given the COVID situation, we're probably going to change a little bit in terms of trying to do more canvassing, do more screening, do more assessments with our teams, and then depending on what they find, take a provider out into those locations and maybe even do kind of like a tent setup, if you will, and field testing. If again they need to get into the clinic, then they certainly will do that.
In a sense, both Zelazny and Hendershot are outliers. Their responses to COVID-19 didn't prompt massive changes to their typical operations, but their shifts reveal what we've seen across industries amid the COVID-19 pandemic. There are areas of improvement, and a rapid willingness to fill the gaps can make all the difference between a clinic that is shuttered and a clinic that is sustainable. Lauren Magarino, Newsy, Chicago.